Lean into that mama gut instinct and get to know your baby. And if you find that something within yourself is telling you that something is wrong, don't rely on a piece of technology. Lean into that.
Yeah,
Call your pediatrician, call back up to the NICU, reach out to your doula. You've got people in your
yeah.
life that you can depend on to bounce ideas off of and to be sounding boards if you think something is wrong. Hello, and welcome back to another episode of the Birth Lounge podcast. If you haven't gotten your hands on the Birth Lounge app, I highly, highly encourage you to do that, well, right now. Pause this episode, run, don't walk, but run to your app store and download the Birth Lounge app because we have brand new evidence hitting the Birth Lounge app this month. The Birth Launch app is designed to support you whether you are trying to conceive, newly pregnant, super pregnant, or in your first year postpartum. Every time that we upload new evidence, it gets downloaded straight to your app, which you can have access to anytime that you want. And not only is it always available and it's the latest and greatest data, but it is structured in an easy to read, glanceable, scannable, evidence based article that has the question, the answer, and the data all laid out for you so you can quickly glance at it and still have all of your questions that you need to ask your provider. Actually, I designed it because I wanted you to be able to sit in the lobby of your prenatal appointment, scan an article, and walk away with the questions that you needed to discuss in the few minutes that you have with your provider. So at the end of each article, you're actually going to find 10 to 15 evidence-based questions that you can prompt your provider with to start that conversation of whatever topic you're looking into. These evidence-based articles are a range of topics of everything that you need to know to have an empowered, informed, and confident birth and postpartum. So things like informed refusal, what are your rights within the hospital? Membrane sweeps. What's the data behind newborn weight loss after birth? How do you prepare your partner? Ultrasounds and Doppler use in pregnancy. How do you get your baby in the best position for an easier labor? What do you need to know about advanced maternal age? Should you be using a birth ball? Should you be making a birth plan? How about induction or C section prep? Or breech birth. And that honestly is just to name a few. My other favorite feature in the app, which I have been using weekly since getting pregnant, is the weekly fetal development updates. So every single week, I tell you exactly what's going on with your body and your baby's body. And I'm not comparing them to some sort of silly little fruit like your baby is the size of a mango. They're really not. Instead, I want you to know exactly what your baby is working on. Things like, hey, your baby now has lanugo, which is their very first hair. Or, hey, guess what? Vernix is now formed on your baby, which is that really fun birthday frosting. This app is like no other app that you have ever seen. I guarantee it. It is going to help you have access to the latest data so that you can be confident in having these conversations with your provider. It's going to give you the latest data so that you're always making evidence-based choices, or at least you know what data to ask your provider about when they're giving you maybe those blanket statement clinical recommendations that so many of us so often get. And it's going to open your eyes to other options that I guarantee the medical system is not telling you about. Head to your app store for iPhone or Android and download the Birth Lounge app right now. Speaking of education that isn't widely talked about very often, Happy NICU Awareness Month. And I know that may seem a little odd because the NICU isn't typically thought of as a happy place. It's generally thought about as kind of a sad place, or at least very intense and unexpected, and a place where people have big decisions to make, experience big feelings, and there's a lot of heartache. However, I wanted to do an episode to help you understand what you can expect in the NICU. And more so, I wanted to help you understand where your healthcare staff is coming from. I'm really excited to be interviewing Brooke Smith, who is a NICU nurse, an IBCLC, a doula, and a childbirth educator. Brooke has been a NICU nurse for the last 8 years, and her first degree is actually in psychology. She started her career at a level 4 NICU and then went into travel NICU nursing, where she got to have a wide range of experiences across many different NICU settings. As we've gotten to know each other online, I asked her to join me on an episode of the Birth Lounge podcast to answer my top questions of 8 things your NICU nurse wants you to know. So often when we have families that have a NICU stay part of their birth journey, when we debrief with them postpartum, they always share in similar sentiments of not always feeling connected with their NICU staff. And there are some times where parents can feel as if they aren't as included as they wish they could have been in the decisions that were made about their baby. So I reached out to Brooke and I said, hey, I would love to bridge this gap between NICU parents and NICU nurses. And I think it would be really cool to talk about the NICU from your point of view so that parents can have a better understanding of the workings of a NICU. She eagerly agreed, and so in today's episode, we're going to dive into exactly what those things are that your NICU nurse wants you to know. We're going to talk about what is it like being on a NICU floor and how can you actually cope with all the machines and the alarms and the wires, and what can you expect as far as communication with your NICU team. We're also going to talk about the resilience of your NICU baby, even though they seem very fragile, and exactly why skin to skin is so important, plus what you can do to bond with your NICU baby, even if they can't be picked up out of their isolette. Of course, I asked questions about communicating with your team in terms of not wanting to bother them, but also, how do you advocate for your baby, especially if you feel like you are unhappy with the NICU care that you are receiving, or you're just simply not feeling heard by your NICU staff? Finally, Brooke and I are going to discuss the roller coaster of emotions that are so commonly experienced in the NICU, plus what that means for your transition home after the NICU and how you can care for your baby and yourself after discharge. The NICU is often a place of unexpectedness. You didn't expect to be in there. You didn't expect it to be part of your story, and you didn't expect to have to learn all this new language, all these new procedures, all this new jargon, and meet all these new people. But I hope that this episode empowers you to ask the right questions, to feel informed about what to expect, and to give you the confidence to navigate that. We're also going to be talking about your feeding choices, support groups, and how comparisonitis might slip in, plus what you can do about it. So without further ado, Brooke, welcome to the show.
Hi, thank you. I'm honored to be here.
I'm so honored to have you, and I always love to have people that I've met on Instagram on the show. And you and I actually met a couple of years ago via
Mhm.
email, just being content creators, and we connected over how hard it is to be in this space of wanting to provide education and being in an industry where there are so many varied opinions. I've loved following you ever since. And yeah, so for NICU Awareness Month, I thought who better to have on the show than you? And I am just really excited to give our audience a perspective of what does your NICU nurse want you to know? Like when you go into the NICU, it can feel so foreign. It can feel really scary and
Yeah.
overwhelming. And I think parents often feel really off kilter because you have these parental instincts, you know what's best for your baby, but when you're in a place like the NICU, it can almost feel like I don't know what's best for my baby, or I shouldn't speak up because my baby is now in an ICU of
Mhm.
some sort, and that the people around me know better than I do. And obviously, people around you in the NICU have medical training that you don't have as a parent, but I don't ever want parents to feel like their parental instincts are not just as valuable as that medical training because in the
Mhm.
NICU, we know that we have actually the best outcomes when parents and providers work together because your instincts are really important. And today's episode, I'm hoping that is what we can accomplish and we can send people away with a really good understanding of what collaborative care looks like and where your NICU team is coming from when they receive your baby, and how you as parents, you as listeners can be an active participant in your child's NICU team without feeling the need to silence or oppress your own intuition and your own voice. And I really want you to walk away feeling empowered to advocate for your baby if the NICU is part of your story. So I think, Brooke, the place that I would like to start is, what do you wish that every family knew when they first stepped into the NICU?
Obviously, most of the time when you are entering the NICU, I would say the majority of the time, it's a surprise. Like you did not expect to be there. Something might have happened with a preemie. Maybe you were on high risk OB for a little bit, but it's still like you didn't know it was going to be that day. Or even with like transitional babies, full term babies that need to come on a little bit of CPAP or something, like they are like, this was not part of the plan. And even that can just be overwhelming by itself. And you're going to be walking in and you're going to be getting a lot of information very fast. You're going to be meeting a lot of people coming in and out of the room. Admissions are normally one of the busiest times because we're just trying to check out, get the baby settled. And so I think kind of just taking a deep breath and being prepared, ask a lot of questions. You might not even have a notepad, but even if you want to get your phone out and just take notes on things that you're already feeling or ways that things you have questions about they didn't understand. That's one of my more practical tips, like we'll talk about later. But I think just remaining calm, taking a deep breath, taking everything in, and know there will be so much time for you to ask questions, advocate more. When you first step in is going to be one of the busiest times. And so kind of just being prepared, but the initial shock is going to be a lot emotionally for everyone.
Yeah, I want to hear your tips because I think that the idea of ask all your questions, it's a really good sentiment, but when you're in it, you can sometimes be like, what questions am I even supposed to ask? So out of my element, I really don't even know where to start. So, what are the tips that you have for families?
I would say so it depends because there's a huge scope of the kinds of families and kinds of NICU stays that we're seeing. We have 24, 26 weekers that are going to be staying 3, 4 months, and it's more like you're part of the family as the team and just kind of it's a longer stay versus, someone that had a full term 39 and a half weeker that just needed to come for 12 hours of CPAP. And so it's really, there's a big spectrum of the kinds of patients and families that we see. But I would say universal over any type of stay would be to have some kind of notebook or even a note on your phone where when you think of a question, you write it down. Because a lot of times I'll like have families asking me a question as a nurse, and I said, oh, when the doctor rounds later today, we can talk about that. And then when the doctor comes, they're like, don't remember any of the questions. And I kind of don't remember every single one either. And so I think that's a big one, is having something where you can kind of jot down. And it doesn't even have to be like the questions you want to ask later. It could be anything. It could be, if you're having a longer stay, it could be like little memories that you wanted to remember. It can be feelings that you felt that you want to kind of like unpack later when you have more time. Just anything, just jot it down. And that's also, I think, helpful for like longer stays when you're not going to be staying at the NICU all the time. Like you're going to be going home and kind of coming back, and you might think of a question when you're pumping at 3 a.m. that you want to remember to ask, tomorrow or whatever. So I think that's one of my biggest practical tips that I try to tell every family is have a special notebook or note on your phone where you can literally write down anything as it comes up to remember later.
It can be really hard to think about all of your questions. I mean, if we think about being in our prenatal appointment where things are pretty calm, they're not
Mm-hmm.
intense, no one is in danger, no one is getting quote unquote, ICU level medical care. You're getting
Yeah.
medical care in your prenatal appointments, but it's not like intensive medical care. And that is even hard to kind of think about what your questions will be, especially if like on the way in, you're like, okay, I want to ask this and this. And then your doctor walks in. Crap, I forgot all the questions I was supposed to ask today. I can only imagine what it is like when
Yeah.
you are in an intensive care unit and the doctor rounds and they give updates and then they say, do you have any questions? And you're like, yeah. At one point, I had a whole list, and now they have just right out of my brain. So I love
Yeah.
that tip about keeping a notebook. Okay, my second question is, what do you wish families knew about the machines and the alarms and the
Yeah.
wires? Because those things are really overwhelming. Visually, they can feel very scary to see
Yeah.
that stuff connected to your really tiny new newborn.
Yeah. Sometimes the machines are honestly scarier than what is like actually happening to your infant. And also, I think a lot of the times, especially with like longer stays, I think parents like get really fixated on the numbers and the screens and the monitors and this machine saying this and this machine is saying that. And I think that is because we are like that in the NICU as providers. We're like, oh, this number is this and this number is that. And I think sometimes as providers and nurses working in the field professionally, like it is hard to remember, hey, let's look at the patient versus the machine, because we do have so much technology that gives us so much information. And I think that we contribute to that problem. But I think just, it's hard. It really is hard. But I think kind of staying focused on your baby. Like we kind of talked about it a little bit earlier, but you're the most important person to your baby, even if they're in the NICU. If, they're in your belly, they know mom's voice versus someone else's voice. They know mom's heartbeat versus the smell. So they know who you are right when they're born. And I think kind of just remembering that, because it can be hard. And I think I'm a great nurse, but I have even been guilty of kind of just being on autopilot, going into the room and taking the temperature and doing this because I have tasks that I have to do. And sometimes I have 3 patients and I'm kind of going and I kind of leave the room and I was like, oh, I forgot to offer to the parent to change the diaper and stuff like that. And so kind of just, I know the question was machines. I think ignore the machines as much as you can. I know that's really hard. And focus on baby. Focus on what you can do, how you can bond with baby, skin to skin, obviously, things like that. Obviously, for a lot of patients, like the machines are going to be, protecting and keeping that baby alive sometimes. So that is a big thing, but it's just hard to be in that. It is hard to be in that environment. And I think just focusing on your baby and what you can do. And yeah, I think that's the best you can do. And
Yeah, and to bring in what we just talked about, asking questions, like don't
Yeah.
be shy to ask your NICU nurse, what is this machine? What is this
Hmm.
telling you? What's the data that you're getting from this sticker or this wire or this IV? What are we giving my baby? Why do they need that? You should be able to ask the questions that are
Yeah.
on your mind to your NICU nurse. And it doesn't mean that your nurse might say, kind of like what you said earlier, let's wait for the doctor. They'll be able to explain that better. But at least your nurse should be able to give you like a high level explanation
Yeah.
of, we've got this in your baby, or we're giving this to your baby, or this is monitoring X, Y, and Z in your baby. What kind of questions do you have about it? Let me answer what I can answer. And then the other ones we can write down and we can ask the doctor when they round. But awesome questions. Now, is it ever appropriate to ask your nurse to maybe silence the machines or silence the alarms in the room if it is causing you anxiety to hear all of these things? Is there a way that we can kind of control the environment similarly to what we
Yeah.
do in labor?
I would say depends on the machine, obviously.
Okay.
I would say, so sometimes we have families that are like silencing stuff themselves, and I would say that's probably not a good idea just because sometimes the same machine is making the same noise for different reasons. And so we might miss something if a parent like silences something. Especially with like feeding pumps, it is really annoying to have to call your nurse when the feeding is done, but sometimes that pump will beep because it's having a malfunction with the syringe and the food is not done, and then you'll silence it thinking it's done, and then I come in and now there's milk that your baby hasn't gotten. So I would say don't silence anything yourself, definitely ask before. But I think a lot of the machines are going to be like, just it's just part of the journey. I don't think it's in the same as in labor where you can stop this for whatever reason, because a lot of the machines are really necessary normally, and those alarms are really necessary like for a reason. I would say one of the things that we do change the parameters for is if we have a full term infant with a low resting heart rate, because full term infants sometimes do have a low resting heart rate, we'll put that parameter down where if they normally preemie goes to that level, it would be like unsafe, whereas a full term infant goes to that level and it's normal. And we'll, in that circumstance, we would lower that like alarm limit so that it's not, that their normal is not like alarming. So we do have a little bit of wiggle room, but I would say for the majority of the time, it's actually, we need those alarms on.
Yeah, you just don't want to
Mhm.
miss anything.
Yeah.
Okay, so what would you tell parents about the fragility and resilience of NICU babies? Because I think a lot of times when we're in the NICU, we can feel as if our baby is just super fragile. And of course, they definitely are getting intensive care support and they are in an ICU setting, but babies are so resilient. And so doing things like taking them out of their isolate and doing skin to skin,
Mhm.
prioritizing, nursing like skin to skin breastfeeding is a good idea for a lot of babies. Now, of course, there are circumstances where it wouldn't be appropriate depending on the medical condition or whatever diagnosis we've got going on. But for a lot of situations, having your baby kind of with you and almost reframing that fragility that often kind of comes along with the NICU can be so helpful.
Yeah, yeah. I mean, a lot of these babies are small, especially if they're like very premature. Like they look fragile. And so it's funny because we do get a lot of parents that like do not want to hold, do not want to get their baby out because they're just terrified. And then those babies are not getting skin to skin, which is so important. Like during that time, they're like, oh, I don't want to take them out because they're going to get cold, or I don't want to take them out because they'll be uncomfortable, or whatever. There's just a lot of misconceptions on that front where parents are like scared. But we do try to educate as much as we can and say, hey, skin to skin is the best thing for your baby right now. It's okay to take them out. They're going to be warmer on you than in the warmer. Like your body warms up for them and stuff like that. In addition to like parents just like needing education on, hey, it's okay to do skin to skin with your baby. It's okay for them to come out of their little home. And even like advocating. So I have been a travel nurse for 5 years. And it's been really interesting because I've gotten to see lots of different hospitals, lots of different states, and I've gotten like a bigger perspective than just like my one hospital that I worked at. And so it's interesting because sometimes the culture in certain NICUs is different than other NICUs. and policies are different. And sometimes, it's more of I think it also depends on like the acuity of the unit and the comfort level of the nurses skill wise and respiratory therapists. Because in some hospitals, like doing skin to skin with an intubated baby, they have a breathing tube, is kind of like really scary and a big deal and like a whole production, where other NICUs that maybe are used to a higher acuity and have nurses that are more comfortable taking care of those patients and respiratory therapists that are more comfortable, like getting a baby out to do skin to skin, even with, a ventilated patient, is not as like the whole world is ending kind of thing. So I think, also, if do you want to do skin to skin when your baby is intubated in a place where they're not as comfortable? So it's kind of like you can advocate and you can ask, and sometimes even just asking. It's kind of like in labor when you are asking for things that like it just takes like an extra step for the nurse to do that she wouldn't really bring up. It's kind of similar to that sometimes, I think, where just asking and just kind of like pushing a little bit like, hey, can I do skin to skin today with my intubated baby, as long as they're stable. We're talking about a stable man, obviously an unstable baby, and it might not be a good time. But if your baby's stable, and even if they have a breathing tube in, a lot of the times, like, you should be able to hold in that circumstance. So I think resilient in that way as well. But babies, like, they are just, it's funny when you work with like little tiny humans, like even 26, 27 weekers, they're so small and they do look fragile and they do look like little aliens, but they have little personalities and they have preferences, and you get to kind of learn that about them. And they deal with a lot, they're getting a lot of blood draws, they're dealing with a lot of pain, they are dealing with a lot of separation from their parents, and this is not normal, like, for a newborn. So they do, for months they're dealing with a lot, and then they go home and they're just like a normal baby, and it truly is amazing. Yeah.
So, what would you want parents to know about bonding with their baby? We obviously have established that skin to skin is really good and in most cases appropriate. What
Yeah,
else can parents do to bond with their NICU baby?
I would say skin to skin is like the absolute number one thing. Do it as much as you can, especially if you have one of those transitional babies where your baby's full term, just coming on for a little bit of CPAP or a little bit of glucose stability or temperature stability. Like, the best thing that you can do is put that baby skin to skin for as long as you possibly can stand it. Dad, get in there too. Everyone, switch off. That's going to be the best thing. But, even the normal stuff that newborns do at home, like changing the diaper, bottle feeding, breastfeeding, those kinds of like more care tasks for sure. But even things like talking to your baby, singing to your baby, holding them, not even skin to skin if you don't want to, but just swaddled, reading them a book. You can bring books from home. A lot of NICUs have books available, like they have programs and they have books in the room that you can read. So just like all the things that you would want to do to bond with your newborn at home, like you can do all those things there. And that's another thing that I normally say to parents is this, and it's similar to labor patients, this does not have to be a sterile hospital room. Like, you can make it your own. Like, you can bring in family photos, and so we have some kind of like fire violations, but most of the time you can set up some family photos, you can put little decorations. I had a really cute family the other day where it was a longer NICU stay. It was an earlier preterm infant, and so they were there for months, and they had a Polaroid camera, and they took a picture with their Polaroid camera every single day, and they had a tweed thread or something, and they would paper clip or clothespin the little picture Polaroids, and they had all these Polaroids in the corner. So I think just making the space cozy and making it feel like special and making it feel more homey could be like super important thing to do, especially with those like super long stays. Yeah.
Yeah, because, like you said earlier, you are in this sterile environment, you are in the hospital setting. So visually, it definitely trips our fight or flight because we all associate hospital stays with being super sick and
Mhm.
danger almost because we are admitted to the hospital. So I love the idea of bringing books from home. I
Yeah.
love the idea of bringing pictures from home. That is just so special.
Bring your own clothes.
Yeah.
They don't have to wear we have little baby hospital gowns, but they don't have to wear that. If you have a super early preemie, they are not going to be in clothes for a while because they have to be cooked up to the temperature regulating isolate, and they don't wear clothes until normally they're around like 1,500 grams, but you can still bring in like a cute blanket. So instead of having like a regular hospital blanket under their bed underneath them, you can have whatever cute blankets you have at home underneath them and take pictures. There's so many ways that you can kind of make the space yours and make them feel cozy, and just like for your own emotional health too, as the family, like feeling like your baby is in a little bit more of a comfy environment.
It's that individualized care that we talk about so often in labor and delivery and postpartum, but we're just bringing it to the
Yeah.
NICU. We're making that space yours. We're making those
Mm-hmm.
memories of you and your baby, even though it may not be how you envision the start of
Mm-hmm.
your baby's life. You can still have so much control over the environment, and I love that so much. Okay, so for families or parents who you know, maybe have a harder time speaking up. And maybe they felt really comfortable in labor and delivery speaking up
Mm-hmm.
because they had done a bunch of work. Maybe you're
Mm-hmm.
part of the birth lounge. Maybe you took a childbirth ed course.
Mm-hmm.
Maybe you just did, a lot of practicing to speak up for yourself in labor and delivery. But now you're in a new setting in the hospital and you feel almost like a bother. What do you want parents to know about communicating with their NICU team to let them know you're literally never a bother? We want you to be an active participant in
Yeah.
baby's care.
Yeah. It's kind of like we were talking about earlier, ask questions. I feel like, sometimes it can be hard or maybe like scary to bring things up that you don't know. Or I don't know if this is even how parents feel, but maybe you feel like you don't know all this medical jargon, and then you're like, oh, I don't want to feel dumb like asking them what this is. So nurses are advocates for the babies. We with the doctors say, we're the doctors and we're the experts in the care, but the nurses are like our eyes and ears. We are physically with that patient. The doctors are with the patient for an hour, or probably less, probably more like a quick exam. And we're patient advocates in a lot of ways. And so I think more day to day, you're going to be working with us. You're going to be seeing us. We're going to be changing the diaper with you. And so feeling comfortable, like bringing up any concerns, the nurse can help advocate, kind of be more on your side. Not that the doctors aren't, but I don't know, there's some like camaraderie kind of there. Oh, let's do that. Get the doctor to do this or something like that. And then I also think that you can be more involved with your care than you might initially think. Like we talked about earlier, you're coming in and these doctors and these nurses are helping your baby and all of this stuff. But I just had a patient yesterday actually at the hospital that was a more long-term chronic lung patient. So the baby was 60 something days old and still on CPAP, which is
Wow.
that's a long time on CPAP. And so it was a lung issue. The baby's lungs are just still just not looking where they should. And we had already tried a few things and gave a blood transfusion and stuff like that. But the doctors were talking about starting steroids and like that option. And the dad was able to say, no, I don't think we're ready for that yet. I think we just did this blood transfusion yesterday and we are doing X, Y, and Z. And so just the fact that you won't be able to say no to everything because some things are necessary for your baby, but in the same way like L&D is. But just the fact that like you do have choices and you do have options and you can ask questions and have conversations. A lot of times and we have like family meetings, which is like not just rounding, but a like set time to have bigger discussions about care with doctors. I would say most hospitals do that. And so they had obviously done a good job of talking to this dad, and he knew, why they were making that, or like why they were making that offer, or why they wanted to do that. But he also knew like he could advocate for, his infant, and he could say no for the time being and try something else or talk about something else. So also not being able not being afraid to like stand up and advocate for your baby too.
And just leading with curiosity of why are we doing this, and then making your decision off of that. I think
Yeah.
that, a lot of times in L&D, there's so much more education around L&D, right? So you really go into it with an understanding of what's evidence-based versus what's not in many cases.
Yeah.
Whereas in the NICU, that's not always the case because there's just not a lot of education around NICU stays,
Yeah.
NICU procedures, what
And
to.
everything is so different. Like even hospital to hospital with treatment, I feel like it's easier to kind of be more informed with like labor and stuff because most of the time there's only certain interventions that you can do. But when you have babies that have all sorts of different issues, you could just, it's impossible to be educated on every single one. Even myself as a NICU nurse professionally, there's still things I have to look up because there's new things all the time.
Yeah, when we're dealing with, really high level care, like just so, I guess, intensive care, like the
Yeah.
ICU, obviously, things are always changing. So it doesn't mean that your providers don't know what they're talking about, or that they are constantly changing your plan because they're not getting something right. And I think a lot of times in general medicine, we always think about, I'm going to be put on this plan, we're going to carry out this plan, and we'll pivot as needed. But in ICU environments, it's much faster than that, right? And so
Mhm.
typically, when something is not working, we don't want to just keep trying it like we would in general medicine,
Yeah.
because that outcome, or the, for lack of a better term, the price that we pay is coming much faster as well. So we do want to pivot fast and get to a new care plan if what we're doing is not working.
Yeah. And when your baby is unstable, it's I mean, it's like minutes things are changing and different meds are being introduced. So like you wouldn't even have time as the parent to even go look up something or ask,
Yeah.
some other trusted source that you have. But obviously, even though this baby was on CPAP, it was still stable and these changes were being made, with weeks at a time. So I would say most of the time, as long as your baby's stable, like you will probably have time to kind of like maybe even say like how you would in labor, hey, can I just have a moment to kind of take this in and think about this choice or discuss it with my partner or something like that.
Yeah. Now, how does that work? Because I guess not how does that work? I feel like you just laid that out. But what do you have to share with parents that, as you said that, they felt like, oh, where's the line in the sand of my parental rights, right? If things are changing so fast with my baby, and there may be situations that my permission is not asked, what happens then? Is your NICU team explaining it to you in the moment if mom and dad are present? Is this
Yeah.
something that they treat your baby and then you talk about and debrief afterwards? Are these situations that, as your NICU team maybe sees them coming down the pipeline, they're coming to the parents to say, hey, we just wanted to put something on your radar. No one knows if it is going to happen. Your baby is starting to show signs of X, Y, and Z. Some of the situations that may arise with these patterns of, you know, symptoms or presentation or whatever could be this and this. We were hoping to have a discussion about what your wishes were in those situations. So, how does that work?
Literally all the things that you just say happen. So sometimes like things are happening so fast and the parents are at the bedside and we're explain like the doctor's explaining it while the nurse is doing it. Other times you kind of have a second where you can say, hey, this is looking like this might go this way, and having a chance to talk about it beforehand. And sometimes if the parents aren't at the bedside and we're doing what we need to do and then telling them after. I will say that most of the time, let's say you're a mom on the high risk OB floor. So there's something going on and you're in the early 20 weeks. Like the earliest legally in the United States that we can resuscitate an infant is 22 weeks. But also there's hospital specific limits based on what technology they have, the skill of their provider. So you might be having a baby, giving birth at the hospital that won't resuscitate anything less than 24. So it kind of, there's like a national parameter, but there's also hospital parameters as well. But in those situations, let's say you're on high risk OB and you're having bleeding or you're having contractions and they're doing what they can, but it's looking, this might be coming in the next week. The neonatologists normally go to those parents and they have that discussion of like, hey, you're at 23 weeks. This is looking like we might not be able to keep the baby in. This is what the outcomes at this gestational age would be. And kind of, it's still a shock and it's still sometimes only a day before you have to kind of make a decision on whether or not you want to resuscitate or not. And that can be, that's obviously very family specific and really hard, but they are having the conversations beforehand. And I think it's something I've actually talked about providers with, because we're not prepared. I'm pregnant right now. I'm 34 and a half weeks and I'm kind of like in that kind of thing myself, but we are not, as families or like pregnant mothers, we're not preparing for that. We're not thinking during our pregnancy, oh my gosh, what if I go into labor at 24 weeks? What am I going to do? That's just, no one wants to think about that. And your OB or your midwife's probably not having that conversation with you because, number one, it just doesn't happen that often enough to be having like routine conversations. But also no one wants to have that conversation either. But I think, and I've talked to friends about this, I think it's important to talk about and kind of research a little bit before getting pregnant. So if you're not pregnant and listening to this podcast, I think that is the best time. And that's because I'm a doula also. So I'm like really into, your positive birth bubble. And I think protecting that is important. And I think having that conversation can be hard mentally while you're pregnant. So I think before you're pregnant, you should kind of think about that. And you can only plan and think so much in the moment when you're making that decision. You might not make the same decision as you thought of before. But I think it's an important conversation to have with your partner before pregnancy, or maybe really early on in pregnancy. Hey, if I'm beginning to have problems or preeclampsia or whatever issue at 23, 24, 25 weeks, what are we going to do as a family? Let's talk about that, because even though it is only like 1% or something crazy, the statistic is so low, it does happen. And many families are not prepared and they haven't thought about it. And now they're having to make this huge life-altering decision with really only as much time as we can give. And sometimes it's only a day, sometimes it's only a few hours, maybe a week. So I think no one wants to think about that. No one wants to talk about that, but I think it is important to talk about that.
Yeah, if there's anything that we do really well here in the birth launch community, it is having the hard conversations and
Yeah.
leaning into the things that can feel uncomfortable, because if we can get uncomfortable now, it will help prevent trauma in the future, and it will help us be more confident in advocating for ourselves and our babies and our families.
Yeah.
Okay, and in L&D, we always say if you're not happy with your care, change providers. If you're not happy
Mm-hmm.
with your care, change hospitals. If you're not happy with your nurse, ask for a new nurse. So, what do you want patients to know or families to know about their options when it comes to the crossroads of your baby is in the NICU and you're not loving the care that they're receiving, and maybe you
Mm-hmm.
as the parents don't feel super heard? What options do we have? It's obviously much harder to just take
Yeah.
the baby out of the NICU and go have them admitted into another NICU. That's typically not an option. So, what options do we have, and how do you suggest that parents go about that?
Yeah, that is hard because a lot of the times changing hospitals or even providers when it comes to like neonatologists or nurse practitioners is really not an option.
Wow.
I don't think really changing hospitals is really ever an option. Like maybe you can pay out of pocket for that, but it would be very costly, like probably tens of thousands of dollars for a NICU transfer. So I don't think that's an option for most families. And then even the NICU teams, kind of similar to maybe like a OB group, you might not see the same OB every day. It's the same way with neonatologists. So there might be, depending on the size of the NICU and how many providers they have, they're switching out. So there might be 5 neonatologists that work in one NICU, and they might, work a week at a time and change off weekends or whatever. So it might not be the same provider every day. And then you might have that same provider for a week, and then you'll get a new one the next week. And then in 5 weeks, you'll get the other one back. So you can't really, or at least I have never heard of anyone like kind of firing their provider because that is kind of who's on. There's not really another option in the same way where you're like, I don't want to go to this provider, but there's also 5 OBs in the practice that I can see instead. So I would say those might not be options. Maybe they are if you look into it more. Maybe I just don't know. But I would say absolutely can change nurses. Absolutely, 100%. If you are not vibing with your nurse or you're not feeling respected by your nurse, like nursing is just like any other career. There's going to be great people in the career, and there's going to be people that are not great in the career. and also there might be great people, but they just don't vibe with your family. Like they're just not the kind of personality that you need. Maybe you need a warm and fuzzy nurse, or maybe you're like, this nurse is way too flighty for me. I need like a more stern, like who knows what. And you can absolutely request. You can call the charge nurse in, tell the nurse that you don't like, worry that you're not getting along with, hey, can I talk to the charge nurse? The charge nurse will come in. You'll say, hey, I'm not feeling comfortable with this person, or I'm not feeling on the same page. Can I get a different nurse? And you probably get a different nurse immediately, if not definitely a change of shift. But that also leads me to wanting to mention, we have something in NICU nursing. I don't think every hospital has this, but the majority of NICUs that I have worked in, we have something called primary nursing. So and it's kind of on both sides. So if you're a nurse that's really vibing with a family, or we bond with patients too. So you're really bonding with a specific baby, or if you're a family or a parent and you really like the care by one nurse, you can kind of request that nurse. And then that nurse, anytime they're working, will have your baby. And not only is that just beneficial, like emotionally and mentally, to just have someone, but it's also continuity of care,
Yes.
like the same nurse is seeing your baby. And I'll just tell a brief story that I think drives home the point of continuity of care and how important it can be. Is I'm from Florida, so I was working in Florida for 3.5 years at a level 4 NICU before I started travel nursing, and they had primary care nursing. So I had really bonded with this family, and it has to be mutual too in most respects. So if the nurse wants you, they go to the family like, hey, this nurse like really bonded with you. Do you want them? And then they say yes. It's kind of like a little matchmaking situation. And I had bonded with this family, and I was their primary nurse. So anytime I came in, I was taking care of that infant. And one day I came into work and I didn't have any like quantitative one thing that I could say. Like I couldn't say, hey, XYZ is different and this number is different. But I just knew because I had been having this baby for months. And I called the nurse practitioner and I said, I have nothing to tell you as to why I know something is wrong, but something is wrong with my baby. Like I know that something is off. And it was just my intuition from knowing that patient. And luckily, I really love that hospital and I really love those providers. And she was like, okay, like we'll do a workup. So we did a septic workup. So that includes like a blood culture, urine culture, kind of like just checking a bunch of blood work and stuff. And in the middle of me getting urine, the baby turned blue, was like going down, and immediately needed to be intubated. And it turned out, we found out later, that it was late onset GBS, which is so rare. It's the only time I've ever seen it in my whole 8 years of being a NICU nurse. But I had nothing to even tell them. Like besides, I just know something's wrong. I just feel like something's off. She's not acting her normal self. And they were kind of more prepared and ready to go because they were aware of the situation than if it had just been, a nurse. Sometimes there's a baby that's there for months and I've never had the patient before. And I'm going in and I've never met them. And I'm like, hi, you've been here for 3 months. And I'm just like, I'm Brooke, nice to meet you. And so would that nurse have had that same feeling that something was off with the baby? I don't think so. And I remember their nurse practitioner, like when things were going down and we were kind of getting the baby back stabilized, like she was like, this is why we have primary nursing. And the doctor was really impressed. That was like probably one of my like most like proud moments as a NICU nurse, but it was all intuition. Like I just knew something was off. And so I would say, you know, if you're a parent in the NICU and you bond really well with some nurse, like not only will you get those like lovey-dovey feelings with your nurse and feel better, but like you also get kind of like safety and continuity of care and like what that can look like for, you know, your stay, the rest of your stay.
That is so dreamy and ideal, right? If we could really kind of hand pick and craft our healthcare system to be what would give us the best results, it would be that really individualized care where you are seen by the same
Mm-hmm.
provider. You have significant time spent with that patient, and there's this, unspoken bond between that provider and patient where that provider is able to tap into their intuition and they are able to say, I don't see anything hard numbers that looks funky, but I just have this feeling that something is off. That is the beauty of the art of medicine,
Mm-hmm.
right? That is what we talk about when we say step away from the machines. Use the machines, but don't rely on them. Tap into your intuition as a provider and really connect with the patient in front of you regardless of what the quote unquote hard numbers look like, because sometimes that intuition is just so spot on. Oh my gosh, you gave me full chills with that story. And just like, how lucky was that family to have you as their nurse? And how lucky was that family to have the opportunity to be in a NICU that prioritized primary nursing
Yeah.
and had a program like that where, that was kind of this honored approach to NICU
Yeah.
care. I just think that is super special.
I would say normally it's bigger hospitals that have primary nursing because they have the staff to support that.
Like
But
teaching
even just,
hospitals, maybe?
I'm sorry,
Like teaching hospitals, maybe?
just hospitals with bigger NICU units. And
Yeah.
it doesn't necessarily have to be teaching, but just because they normally have like different programs and things like that that smaller hospitals might not.
Okay.
So I would say, but even if you're at a small hospital that might not have that program, I would say that's another one of those things that you can kind of bring up and try to advocate for yourself, even if it's not normal there. You can see, hey, I really like this nurse. Can I have them more often? And they probably would say yes.
Yeah, especially if that nurse feels really connected to you as a family
Mm-hmm.
and you've got that kind of mutual sense of connection that you talked about earlier. I don't see why any NICU program, regardless of whether they actually had the primary nursing approach or not, would
Yeah.
say no. It just makes sense. Oh my gosh, I love it so much. Okay, so we've talked about the wins that could happen. And we've talked about how do you advocate for your baby. What do you wish parents knew about the emotional roller coaster and the days of feeling like they failed, or days that are filled with big emotions or big decisions? What do you have to share with those families?
Yeah. I mean, I think all feelings are valid. My first bachelor's is in psychology, so I kind of have a little bit of like psychology background. But I think just accepting whatever emotions like come up for you. You know, you're in this unexpected situation that you weren't planning. This wasn't, ideal in most situations. And I think parents feel a lot of different emotions. I think there's a lot of fear, like there's a lot of scariness about the NICU and just kind of accepting that. Or maybe you feel guilty because you feel happy. You're like, I got to meet my baby early, even though it's not the best thing. I shouldn't feel that way. Just accepting whatever comes up and working with that. Nervousness, being overwhelmed is so common, which brings me to the point of also like you have to take care of yourself. You can't take care of your infant if you're not taking care of yourself. So we have families that are just so burnt out because they're always at the hospital. They don't sleep a lot because, of course, when they're home, they're pumping or whatever to bring breast milk back for the baby. And you can just tell they're so depleted, like physically, emotionally, spiritually, everything. And I think taking breaks to nourish yourself with food, but also with love and self-care and some deep breaths in nature or taking the day off. As nurses, like we love your child too, a lot of the times, especially if we're bonded with your baby. And you can take an afternoon off to do something for yourself or make sure that your needs are being met and trust your infant, with us. So I think that's really important too, that parents don't think about. They're just giving and giving because it's a lot to have your infant separated from you. But just making sure that you're prioritizing your own care. Your baby can feel if you're stressed, you're depleted.
Yeah. It can also feel really, I guess, like you can feel guilty if you do take time off, right? You
Mhm.
feel really obligated as a parent and not obligated and, oh, I have to do this, but I really want to be with my baby
Mhm.
24/7. And so there's this level of commitment and dedication that parents can sometimes have almost to their own detriment, that I'm going to be at the NICU every single waking
Yeah.
moment. I'm going to wake up early. I'm going to stay really late. I'm going to drive 30 minutes or an hour home, and then I'm just going to sleep for a few hours. I'm going to go right back. Love that you point out like your baby can feel that you're stressed. And it's a balance. Every family is going to have to kind of find what works for them. But,
And
it's hard. You're in a place that just ultimately sucks. And there's no right answer. It's a balance of you have to find a place where you feel like you're with your baby enough, but you also are not depleting yourself to a point that you can no longer serve your baby.
yeah.
And that's kind of what it is. So we want to be sure that we're striking that, because if you are just so tired, I mean, not only is that dangerous for you, right? Like, we don't want
Mhm.
you driving back and forth to the NICU, even if it's a 10-minute drive down the road, if you're so tired. It's just
Yes.
dangerous. And we also wouldn't want you making medical decisions about your baby or the care that they're receiving if you are so tired, and your questions aren't going to come as
Mhm.
easily. You're not going to be thinking with a clear mind. It's going to be really tough for you to hear sensitive information or
Yeah.
have these discussions with your NICU team. So trust that your NICU team does love your baby. Um,
Even your supply, stress
yeah.
your supply. And for a lot of moms, like pumping is like the one thing that they feel like they're doing for their baby. And then if they're depleting themselves too much, they're not taking water breaks, taking food breaks, taking mental health breaks, like you're just stressed and your milk supply is going to go down. And then what does that bring? That brings like even more guilty feelings and, feeling like you're not able to, you're failing or something like that. So it's just multifaceted, a reason to take a lot of breaks and take care of yourself.
And just remembering that you did just have a baby, right? I
Mm-hmm.
think a lot of times as moms and as women, we have this way of saying, I'll get to myself later, or I'll do that for
Yeah.
myself later, or yeah, I'll focus on my own healing later, or I'll eat later. I'll eat in a couple of hours. But the truth of the matter is, you just had a baby, and you
Yeah.
have to keep that in mind,
You're
that
still healing
that's
yourself. Your
exactly it.
hormones are still out of whack yourself. Yeah, it's definitely a hard boat to be in.
Yeah, and it stinks. And I just want to recognize that if you're feeling that pull to be here and there and all the places, like, there is no one good answer. I do wish I could wave a magic wand and give you a
Mhm.
good answer, but you should do what feels best to you. Recognize that your NICU staff loves your baby as not as much as you love them, but they love
Yeah.
them like they're your own, or like they are their own, and that your baby's in good hands.
Yeah. And I think support groups too are way underestimated, just like any other situation. Like a lot of hospitals will have like hospital-based support groups for families where they get together and the babies are in your same NICU, have the same providers and might be encouraging to talk to, but even like online groups and things. I think you have to be careful with that because I think the support is the best thing, but I think also being in other groups like that might play some games with your mind with comparison. You're seeing another baby that was born at 26 weeks in their home, and now your baby isn't, and kind of feelings that come with comparing. I even have families that compare their own different babies' NICU stays. So they would be like, oh, like I had this baby and this happened to my first daughter and they only had to stay for a week. And, why is my second baby having to stay longer and things like that. And I would say definitely like it is awesome to go to support groups, but don't get caught in the trap of comparing your baby's journey to another baby's journey and then, taking that with you. Yeah.
Yeah, comparisonitis is so hard and it's so human, right? Like, there's no shame if you're feeling that comparison, but just know that just like every pregnancy and every labor and delivery experience, every NICU experience is going to be as individual as your fingerprint as well.
Yeah.
Okay, I want to wrap up here because I want to ask about something that I think doesn't get a lot of light and that I hear as a doula, parents feel could use a little bit more attention when it comes to NICU, and that is about transitioning home. What do you wish families knew about discharge and transitioning home? Because a lot of times it can feel very lonely. You can feel oftentimes unprepared. And okay, we just came from a place where my baby had 24/7 care. I
Yeah.
always had someone to talk to, I always had someone to ask questions to. And now all of a sudden I'm home and it's just me, myself, this baby, and my
Yeah.
partner, and we don't really know exactly what we're doing.
Yeah, no, that can be hard. I think the whole like NICU just breeds number fixation. So even when families are going home, they're so fixated on the exact milliliters my baby's eating of breast milk and should we get the owlette sock because now they're not going to be on a monitor when they're on a monitor the whole NICU stay. And so those transitions can be so hard. I would say, and also, in the NICU, I wish this was better, but the breastfeeding support is just not normally as supportive as I wish it was, I guess. It's a nice way of putting it. I don't think it's like prioritized as well as it should be. So I think number one, try not to be so focused on numbers and obsessed with numbers. We as providers and like medical professionals, we're causing that. So it's us, but try not to do that, but get support outside of the hospital. Just because you left the hospital after months in the NICU and you're bottle feeding when breastfeeding is what you wanted to do doesn't mean you cannot make that happen with like outside help. I'm also an IBCLC and I find a lot of value in private practice IBCLCs versus in hospital. I see a quality difference. Don't want anyone coming at me for that, but I do see that a lot.
Canceled.
Not a standard rule 100%, but I would say common. So if that is a priority to you and you're feeling like, oh, I missed out on my breastfeeding journey and I think that there's a lot of great IBCLCs outside of the hospital and private practice that would be able to help you transition. And even if it's not 100%, even if it's not exclusive nursing, but it's just like they can nurse half the time and supplement after or whatever, I think that if it's important to you, it's worth it to get that help. Yeah, the number fixation. And we don't recommend any like home monitors. A lot of the times, if you ask like the neonatologist before you leave, oh my gosh, should we get the owlette sock or whatever? Even it's become so mainstream that I feel like I see my friends that are like normal families that didn't go to the NICU that are like wanting to get owlette socks for home. And I'm like, oh my gosh, we say don't do it because it just causes so much anxiety. And especially if you're a NICU parent, you probably have a lot of anxiety as it is because you just saw your like medically fragile infant stay in a intensive care unit for a while. Now you're having to take that baby home and you don't feel those like safety nets behind you. But we do say that if your infant is leaving the hospital, like we would not let them leave if there was even an ounce of anything that we were scared of. So once your babies leave, there's clear on everything and they're like a normal term infant. And so let that anxiety go, which is hard. Like I feel like in our society and culture where there is so much fear around pregnancy and postpartum and labor and just childcare in general, like you're going to be dealing with that whether you're a newborn NICU parent or you're not. Like the anxiety just around parenting and making the right choices. There's also like new parent support groups normally like in your local area too. So I would say, yeah, join a support group. Try not to have too much anxiety.
Or have a really tech-based home. So instead of buying a piece of technology, I'm really going to challenge you to lean into your own intuition, lean into that mama gut instinct, and get to know your baby. And if you find that something within yourself is telling you that something is wrong, don't rely on a piece of technology. Lean into that.
Yeah,
Call your pediatrician, call back up to the NICU, reach out to your doula. You've got people in your
yeah,
life that you can depend on to bounce ideas off of and to be sounding boards if you think something is wrong. But don't forget that you never ever need permission to get something checked out. You don't need a medical professional or your doula or your mom to tell you, like, yeah, go in and get that checked out. If your
yeah.
instinct is saying, take your baby in to get checked out, then worst comes to worst, you put them in the car, you get checked out, everything is good, and you go back home. And the worst thing is that you have just spent a couple of hours getting checked out, and a couple of hours of your day is gone.
Yeah. And also, I think a lot of new parents, especially first time parents, they don't know that even when the pediatrician's office is closed, there is someone that can answer your questions if you call. Like, there's like a nurse normally overnight or some kind of service that you can use where, you can call at 3 a.m. and be like, oh my gosh, my baby made this gurgling sound. Is it fine? And the nurse will like, you're okay. But, having, especially as leaving the NICU, those types of things creep up. And so I think a lot of first time parents aren't aware that is you call anytime. You don't have to wait for the office to open at 9 a.m. the next day or whatever.
Which is a great question to ask when you're interviewing pediatricians is where do I call? Who is on call for me when the
Mm-hmm.
office is closed? And how can I get my answers, that I need? But also, if you didn't ask that question or if, haven't necessarily settled on a pediatrician, you don't have to be checked into the NICU to call up there. You can say, hey, we were discharged earlier this week and I just have a question and I'm not able to get a hold of my pediatrician. I was hoping you guys could answer this, and I'm sure those nurses would be more than happy to answer it, you guys. And they probably will be so happy to hear from you. They'll be like, oh my God, hi, how are you guys
Yeah.
doing? How was your last couple of days at home? We miss you guys. We're glad that you're not here anymore, but we miss you guys, and it's so good to hear from you. All right, Brooke, this has been so fantastic. I have one last question, and it's not for the parents. It is actually for friends and family of people who are in the NICU. What do you wish those people knew about supporting families who are currently in the NICU?
Yeah, I mean, I would say the same stuff. Like, what would you do for a newly postpartum mom if she was home 3 days after she left? I'm more in the camp of services, help with services over things, like not an outfit for the baby, but a meal, or come over and clean their house, or hire someone to clean their house, pay for a lactation visit, private practice, be the little community and village to kind of take care of everything else on the outside. I would say, especially like meals and just like tasks around the house and stuff. So that way, like, you're not home a lot when you're in the NICU because you want to be with your baby. And so when you are home, you're going to probably be sleeping and you don't have time to throw in that load of laundry or meal prep something. And so I think, kind of helping fill in those gaps of just home and life care for them would be like super helpful.
I love that so much. Oh my gosh. Brooke, you're such a wealth of knowledge. You are such a warm spirit. And just thank you so much for being here with us today and sharing all your wisdom, sharing all your knowledge, and sharing what we can do to make the NICU stay, if that's part of our experience, an easier one. And finding some joy, albeit maybe it's a little small on some days. Other days it will be big joys and it'll be big wins and you will be seeing that needle move in the right direction more and more towards discharge, and I just know that that is
Mm-hmm.
such a good feeling. If people wanted to connect with you, learn from you, how can they do that?
So I don't have quite as big of a backbone as you for having social media. I thought about that for a little while, and we had that conversation years ago where I'm like, I don't think I'm cut out of that cloth to deal with that. So I don't actually have a business page or anything like that. My Instagram is Brooke Palm Smith. If you just want to follow along with my life. And sometimes I am posting like, I'm a birth nerd, so I'm posting studies on there for my family and friends, but nothing, no business as of right now.
That is a-okay. Not everybody that comes on the show is a business owner, and I like it like that. I
Yeah.
love having people that are just caring for families and, just making our lives easier in one way or another, and you don't necessarily have to have a business for that.
Yeah.
All right, you guys, I will see you in the next episode. Be sure to follow Brooke on social media if you feel so inclined, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.